Hey, good afternoon. This is the second half of Ask the Experts. So for the last 6 months, we've been getting your emails and you've been asking us to do a show on dental implants. Well, we've been sold out, so we weren't able to do that until just recently. And I think we lucked out because everything I've read about this practice is nothing but positive. The name of the practice is South Florida Center for Periodontics and Implant Dentistry. So we are going to have every month now a show on implants. And this show, I'm telling you, it's going to grow bigger and better than probably most of our shows. Now, we don't just have one of the dentists in today. Now, are you called doctors or dentists?
We go by either one.
Either one. So we have one dentist and one doctor in the studio today. No, we have Dr. Fred Norkin and Dr. Jeffrey Ganales. I am so glad to have you guys here. And so for the next 30 minutes, we're going to talk about implants. Great. Because it seems a lot of people don't understand about implants. And we were just talking. I told everybody that we have had so many emails this week from listeners wanting to know about implants. They want to know if you do the in one day implant. Is that what it's called?
Right. Well, actually, it's a technique that we pioneered called Teeth Today, which we pioneered about 15 years ago. And we probably have more experience doing that than any group in the country. Essentially, what it allows us to do is take patients who have failing and missing teeth and replace them in literally one day with teeth that are fixed. Wow. They don't come in and out. They don't have to sleep next to their teeth anymore.
They're extracted, or the teeth are already missing?
We do it all at one time. So if the teeth are present, we'll take them out if they're failing. If they're already missing, then we can help them as well. Get rid of dentures, get rid of those teeth that don't feel good, give them back their confidence, give them back their smile, give them back their dignity.
Well, first of all, tell me about your practice.
We've been in practice in South Florida, in Boca Raton, for almost 50 years. Now, neither of Fred nor I have been there that long. But we joined this practice, me in 1990, Fred in 2001. And we have been sort of the class act of specialty care in periodontics and implant dentistry since the beginning of Boca Raton. And we now have 4 board-certified specialists. We have a state-of-the-art facility. We have every piece of technology there is available, and we offer all the services there are. So it's very reasonable to come in, get your treatment done, be comfortable, and make sure that you have a great outcome afterwards. One of the things that's really important, though, is we're all specialists. And
you can actually call yourself experts because you're board certified.
Right. All of us are board certified.
And in dentistry, there are only 9 specialties in dentistry. Periodontist happens to be one of them, and only a small percentage of the people who qualify to call themselves specialists are board certified. We sort of require all our doctors to be there, and we maintain that expertise by going to a zillion courses. We teach those courses. We're known worldwide for what we do.
Well, first of all, you do see patients from Broward, and I bet you even see them from Dade also, even though you're located in Palm Beach County.
We've actually seen patients from as far away as Russia. So,
that's not a good word right now.
It may be a controversial word, but we have seen patients from as far away as Russia. But we do see patients routinely from Palm Beach, Broward, Dade County. People fly into it to see us from the Northeast, from the Mid-Atlantic states, from the Midwest. So we have a lot of patients that go back and forth, and we have relationships with other doctors around the country. So if we ever need any problem solving, we know that those patients can be taken care of. We also have relationships out of the country. So when we have a patient that perhaps needs problem solving out of the country, we're only a phone call away, an email away.
Well, the nice thing about our show, you can actually go to your website right now and watch the show live, or you can come back later and watch it because it's going to be up there. If you'll go to www.flsmile.com, you'll actually see the show on live right now. And again, you can always go back and look at it. We had somebody from New York contact us, and they wanted to know if you did the implants. They go back to New York. What did you do then? Do they see somebody in New York? if there's a problem or anything, or do they come back? Because she had said that she heard that you have to do special cleaning when you do implants.
We have lots of contacts all over the world. And sometimes if you have treatment done here, we will continue it along with some of our colleagues and friends in
It's a lot of snowbirds.
New York. Snowbirds. We see snowbirds all the time.
Actually, just to interrupt, we actually referred a patient to Jerusalem today.
You're kidding.
So we can take care of people most anywhere.
I know you're not allowed to give names out, but did that person from Russia's last name start with a P?
No.
Okay, just wanted to make sure.
As far as I know, no relation.
Just wanted to make sure. So tell everybody, what is a periodontist?
Sure.
They're trying to think what it's
Yes.
How do you...
We're the branch of dentistry that deals primarily with adults that have problems with their gums or infections of the gums or teeth. And most adults who lose teeth lose it because of gum disease or periodontal disease. It causes the gums to bleed. It causes bad breath. It causes teeth to loosen. And if it's not treated properly, you start losing teeth. And almost half of adults in the U.S. have moderate or severe periodontal disease. So it's a pretty common problem. We treat that, and that's our primary goal, actually, is to help people save their teeth. But when you can't save teeth, periodontists also do the procedures to replace those teeth, and we use dental implants to do that permanently. So you can come in with a mouth of failing teeth, and sometimes we can fix them. And if we can't fix them, then we can replace them. And we're sort of right in the middle of that process where we are often the people that diagnose the problem. We often coordinate the treatment. And then we work with other dentists to make sure that your new teeth or your existing teeth look good, feel good, and function well.
Listen, we want our listeners to go the best, and this is not a knock against general dentistry, but should you go to a general dentist to have this done? Shouldn't you go to someone like practice that specializes in this?
Well, experience counts. And
Because this is basically all you do, right?
this is literally all we do. And this is what we're specifically trained for. So what Jeff was getting at is that we oftentimes may act as the quarterback in the treatment process, but we really do focus in on what we do. So we have knowledge and experience in other fields where we can weigh in and perhaps direct the patient in the right direction and work with our restorative colleagues and other colleagues within dentistry. But in that respect, we're just the quarterback. When it comes to the actual treatment, you wouldn't send your wife to have a baby with their general practitioner.
Right.
You would want her to see an OBGYN. If you had a heart problem, you would go and see a cardiologist. And it's the same with what we do. Yes, there are many people that may take some courses and feel that they're experienced, which is great. But if it was my wife, I'd want my wife to see the OBGYN. If it was my parent, I'd want them to see the cardiologist. And if it comes to dental implants and periodontal therapy, you're going to want to see a specialist. Just like if you need a root canal, you're going to want to see an endodontist. So an orthodontist to take care of your kids' teeth and getting them straight. Each of us has our own specialty and our own real bank of knowledge and our own experience that we can then add to that. And the fact that we're board certified means that we're routinely every 7 years recertifying. So there's a process that comes up every several years to make us continue to have that certification.
I'll throw a question out there. Can you do an implant if a patient has lost a lot of their bone?
Most of the
Did
time.
I ask that right?
Yeah, and that's a very common question. It's a really good question because a lot of people think that if they lose their teeth, then they lose the bone and it's all over, that you can't do anything else. And it's extremely rare that you lose enough bone that you can't have an implant placed. And even if you got to the point where it was somewhat questionable, there are all sorts of techniques and methods available to regenerate that bone. So we do lots of bone grafting too in order to make sure implants can be placed predictably and safely. So on both sides of that question, there almost is no such person who has lost too much bone to have implants placed. There's almost nobody who's lost so much bone that they can't have permanent teeth again. It's really just a question of finding the right mix of procedures in order to fix the problem.
We've actually have a good friend of ours, And it's so sad. She's a beautiful woman, but when she smiles, she's missing 2 teeth. And it just changes how you look at her.
Sure.
And she feels really bad about it. Now she's finally gotten the nerve, because a lot of people think this is really painful, which I want to go into. And she's actually been afraid to have it done.
Sure, and that's a common thread. We see people like that all the time who have lost that self-confidence. So what we're able to do for people is restore that confidence by giving them back their smile, giving them back their complete sense of self. People are always frightened that dental implants are going to hurt. And in general terms, dental implants don't hurt. They'll be sore afterwards. They may have some tenderness, but they should be able to resume their regular activities
next day.
They can eat that day. The fact that patients are fearful is a very, very common thing. And I think the greatest thing that we find is that if we reassure people that they're not alone, it's not just them, it's most people are frightened of us. With that, we offer a lot of opportunities for patients to go through these procedures with sedation. So 2 of our doctors are certified to do conscious sedation in the office, where we can literally put you out using IV sedation. We also have an anesthesiologist as part of our group that is able to go to a deeper level of sedation. So we offer a myriad of options, including laughing gas, nitrous oxide, oral sedation, IV sedation, an anesthesiologist that will let patients get through these procedures. And we always tell them the hardest thing for them to do is just walk across that threshold. If they can do that, we will take care of them from that point forward.
So when someone, and this, I got to tell you guys, we had some questions here planned, but I love this area. I think what you do is amazing, because you really do change people's lives. I mean, you're not just sticking a tooth up there. You literally change lives. And I think that a lot of people perceive like we're talking about certain things that aren't true. Are there different types of implants?
There's all sorts of implants. There's dozens of manufacturers, and
But how do people know what they want, though? I mean, I come into your office and I'm missing several teeth. How do I know what kind of implant?
it's the wrong question to ask. The right question to ask is, what do I want to look like when I'm done?
Okay.
And typically the answer to that is, I want to have teeth that don't come out. I want to have teeth that are comfortable, and I want to have teeth that look natural. You got to leave it to the experts to fill in the blanks as to how to interpret that goal with what you're starting with. And that's what we do, is we sit down and we talk to you, and we try to figure out what's wrong. We use all sorts of sophisticated x-rays and diagnostic tools and photography, and we have digital scanners, and we actually have an in-office 3D scanner, so we can look at the jawbone very carefully and safely, and we know where the safe areas are and the areas to avoid are. And we come up with a plan, and we can explain it to you, because we're tuned to do that. And almost everybody can go through that. And I wanted to go back to one of the other questions that may not have been completely answered. There's this perception that implant dentistry, or having a procedure done, is painful. Most of our patients, I would say easily 80%, don't take more than Tylenol or Advil afterwards for pain medication.
Right.
And if you gauge the level of pain medication to the level of pain, that'll tell you that most people don't have much discomfort at all. Some do take narcotics afterwards, and we prescribe them every once in a while. But Fred and I will tell you that it's not more than 2 or 3 people a week, and we're doing implants all day, every day.
Can people go back to work the next day? Or
Absolutely.
Do you not? Okay, so
They always do. Yeah.
they always go back to work the next day.
Yep.
So 5 years ago, my sister in Dallas had 4 implants. It was a long process. So have things changed a lot? Because they had to, I mean, she literally took maybe 4 to 6 months.
Sure, and part of it's that the technology has caught up with the process and the disease, and part of it is religion versus science. So religion tells us that we should wait 6 months, 9 months, a year for an implant to heal. The science, though, tells us that the implants that we're using in our practice are healed at 6 weeks, 8 weeks. And so there's really no reason to extend this process. Sometimes when we do more extensive grafting, we might wait a little bit longer. But even in those instances, it's rare that we'll wait more than 3 months. So the process doesn't necessarily have to be drawn out. Oftentimes it gets drawn out by logistics for people traveling. But the reality is that when we look at the science behind it tells us that we don't have to wait quite as long.
Well, first of all, I got to tell you, I've been doing this for 8 years now. I love the fact that this is really all you do. And you gave a good analogy before, because I remember 5-6 years ago, there was a dentist that said they did everything, including Botox. And you can't, this is all you see. So I always say on my show that if you're going to go to someone that this is basically all they do, and not some big, shingle going down the wall of 10 different things. So I love what you guys do, and what we're hoping is that these people who are afraid of the pain, we don't need to get into prices, but is it real expensive? Because I know there's some cosmetic dentistry that gets up there, like, I guess, velours, or is that
Veneers.
Veneers. And is it by the tooth? How do you charge?
Cases, fees.
Everybody's probably different.
Everybody's different, and fees are kind of by the amount of work that goes into it. There's time, there's materials, there's expertise. It's really hard to come up with a price per tooth. And
Right.
what's expensive for one person is not expensive for another. Also, you have to look at implant dentistry lasts an awful long time, and sometimes it's a lifetime. So whereas a crown may be $1,500-$1,800 and lasts you 7 years, which is what the insurance industry tells us, an implant in the crown may be $35, maybe twice that, but it may last you 4 times longer. So it's hard to know, and the best way to find out is really to get a diagnosis so you know exactly what you're talking about.
You can come in for a free consultation.
Well, we will talk to patients. We will give them an idea what is going on.
Because they don't usually know anything, do they, when they come in?
We have them speak with our treatment coordinators,
Okay.
and just have a conversation about what's reasonable and what's possible.
We're going to take our first break and let you guys rest your voices. Again, you can go to www.flsmile.com. You can call tomorrow. Actually, probably tomorrow. Make an appointment. 561-912-9993. The name of the practice is South Florida Center for Periodontics and Implant Dentistry. We'll be right back.
Get your smile ready for summer. Are you missing teeth? Do you have loose teeth? Can you bite into an apple? Is your smile ready to hit the beach this summer with confidence? We all work out and try to look great since we live in paradise. You need a smile to match. The South Florida Center for Periodontics and Implant Dentistry can help you replace those failing or missing teeth with a beautiful smile and the confidence you deserve. The doctors at the South Florida Center for Periodontics and Implant Dentistry have helped thousands of patients rejuvenate their smiles for nearly 30 years by replacing failing and missing teeth with dental implants. Often new teeth are replaced the very same day using the technique they pioneered more than 15 years ago. Teeth today. At the South Florida Center for Periodontics and Implant Dentistry, all of their doctors are board-certified dental specialists. They have placed thousands of dental implants. And we all know that experience matters. Call the South Florida Center for Periodontics and Implant Dentistry today to schedule your free consultation. Call them at 561-912-9993. You'll be glad you did.
Hey, we are back. Again, the website, you can go watch the show right now. You can go tonight and watch it. www.flsmile.com. The phone number is 561-912-9993. What question do most people ask when they come in?
I think most people want to know if it's going to hurt. Yeah, that's the biggest issue. We get a lot of patients that are frankly very anxious when they come in, and the first thing we try to do is reassure them that lots of people feel the same way, myself included, by the way. None of us like to be on that side of the chair. But what we also try to make them aware of is that we do this every single day for a living. We have predictable outcomes. We have patient after patient that have had success, and that they're going to be just fine. And if they just let us do our job and take good care of them, it's not just Jeff and I and Lily Aaron and Sammy Svaz, our other colleagues in our practice, but it's the whole team around us. We have a whole support team of dental hygienists, surgical assistants, administrative people, treatment coordinators, so that from the moment patients enter our practice to the moment they leave and every moment in between, they're going to be handled with care, with people who truly have an understanding about what they're going through, what their anxieties are, and let us get them through the process. And that doesn't just mean when they're physically in our office. We have a team of people that are available to them. They can call in with questions before the treatment. They can call in with questions during treatment, after treatment. They always have a liaison. We have treatment coordinators that have years and years of experience. They are very well versed at what we do. Our surgical assistants are very comfortable handling our patients. And then long term, our patients often stay with us for maintenance. We have hygienists that have a tremendous amount of experience in handling people who have been through these types of procedures, had periodontal disease, had dental implants, had a lot of complex dentistry, and really understand how to handle our patients, particularly the ones that are a little nervous and anxious. And what most of our patients come back and tell us at the end is they don't know why they were so wound up and anxious, and that in fact now they're calmer and they realize, wait a minute, it wasn't quite what they expected.
Well, that's one of my next questions. I also want to tell a little story that why I keep pushing about this is what you do. This is all you do. A friend of mine was trying to get the best price. They weren't trying to get who did the best job. And on this show, we tell people it's not about who gives you the best deal. And another thing is we don't want you Googling someone. We have someone right here in the studio, but a friend of ours, she was missing 4 teeth, and it was the worst experience. She had somebody who, it's like a factory, I guess. They're a national company, and I don't even know if they knew her name after 1 hour with her, if you know what I mean.
Sure.
So, but she was out there looking at price, and this is not a happy camper, I got to tell you. This is something I would think that this is important. This is your appearance. This is how you feel about yourself. You want someone that really understands like your group does. I think that's really important.
I think you got to realize you're replacing a body part here.
Yeah, that's right.
We see people that go to Costa Rica and Colombia and not Venezuela, but Mexico, and then we fix those problems. And, they're kind of ashamed that they're coming back and doing it, but
because they try to save a little money.
Because they save money.
Right.
That's the medical tourism industry, which is big. But we take what we do seriously. We've been doing it a long time, and we do it well. As a aside, you may remember the television show Extreme Makeover.
Yes.
Well, in the early 2000s, 2001, that show came out, and they were doing all sorts of cosmetic dentistry, but they weren't doing implants. And the reason they weren't doing implants is because they had a very short window. They needed to see results in 4 weeks or 8 weeks, and they couldn't find anybody to do procedures that fast. I became the implant surgeon for Extreme Makeover and did 4 shows for them. And
Same
2
show
more.
except for dentistry.
But no, it was this show.
Oh, it started off as a dentist.
Yeah,
it's a dental show
was
rather than plastic surgery.
Right. It was the dentist who started it and then brought in the plastic surgeon, the hair transplant, and the refractive surgeon and cosmetic dermatology. But it was the dentist who started it, Bill Dorfman.
Dorfman, yes.
And
I was Beverly Hills, I think. Yep.
I was his implant surgeon, and I went out there, did the shows because he couldn't find anybody on the West Coast to do these types
I
of
remember
cases.
that. That's
And
nice.
the point is that we have been doing this for a long time. We've been doing it longer than any of the national chains that have been out there. We've been doing it long than the buzzwords like All on 4 and some of those other services that are now advertising big. We created the phrase teeth today to explain what we did in 2001. So we've been doing this a long time, and patients who come into us, they want to know if it's going to hurt, and they also want to know if it's going to work.
Well,
tell
I
them
told
it's
you
gonna
this goes by fast. I told you 30 minutes go by. Here's a phone number, 561-912-9993. The website is www.flsmile.com. And go back tonight and watch her tomorrow. And you guys will be back next month.
See you next
Thanks so much. We'll be back with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Experts show. Tune in while some of the top local experts in their field from Broward and Palm Beach counties educate you in the areas of law, health, financial, and home improvement. You can also call our offices at 888-574